I'm 21. I feel fine. I don't have sex with the kind of people who would have AIDS, so what exactly is it that I'm supposed to know?
I'm a woman. How can I get AIDS?
Nothing touches me. I really don't think I can get AIDS.
I find condoms irritating. So does my girlfriend. Why should we use them?
It's something that we've all heard about, but a lot of us still have questions about AIDS. And what we're going to do today is talk about AIDS, about what AIDS is, about how you get it, and about how you can prevent it. But before we do that, we should know what is happening with AIDS. AIDS is spreading very, very rapidly. It's spreading in all of our populations. Right now, there are 500 cases of active AIDS in the state of Mississippi. There are 3,000 cases in the city of Chicago, and there are 2,500 cases in Atlanta. However, there are 10 times more people who are infected with the virus and don't have any symptoms, but that have the AIDS virus in these cities. So we're talking about 30,000 people in the city of Chicago. We're talking about 25,000 people in the city of Atlanta, and we're talking about 5,000 people in Mississippi that are infected by the AIDS virus. And there may be even more. We don't know.
Isn't AIDS just a white people's disease?
Anybody can get AIDS. It's not who you are, it's what you do that counts. And one of the things that's very important to know is that AIDS is spreading fastest in communities of color, in black communities and Latino communities. 80% of the babies that are born with AIDS are black. 60% of the women who have AIDS are black, and 85% of IV drug users with AIDS are black. Right now, 57% of AIDS cases are black, and blacks are 13% of the population. So this is something that is very, very dangerous, that is damaging black communities, and that has to stop so that communities can continue and survive. Now, the question is, what is AIDS? A lot of people have heard about it, but a lot of people don't know what AIDS is. Now, what does AIDS stand for? Anybody know what AIDS stands for? The letters AIDS? Acquired Immune Deficiency Syndrome. Now, what does that mean? Acquired means that you can catch it. Immune means it affects your immune system. Deficiency means that it destroys, actually, your immune system. It makes it not function. And syndrome is a collection of symptoms. So acquired immune deficiency syndrome, or AIDS, means a disease that destroys your immune system. Now, does anyone know what causes AIDS? The HIV virus. That's right, Bashira. The HIV virus causes AIDS, and the HIV stands for human immunodeficiency. It means that it's a virus. It means it's a virus that affects only human beings, and it affects their immune system. Now let's talk about how the AIDS virus strikes and what it does, okay? Now, what's a virus? Well, a virus is like a little germ, okay? And what it does is it gets into your blood and it destroys your immune system. Now, what's the immune system? Well, the immune system is what protects your body against disease. Now, your skin is part of your immune system. It keeps out germs. The hair inside your nose is part of your immune system. However, the most important part of your immune system are your white blood cells. And they're white blood cells called T4 cells that fight disease. Now, when you get sick, has anybody here had a cold in the last couple of weeks? Cold, sore throat? Okay, Renata, you haven't. What happened to you after you got the cold?
Yeah, I had a cold. I was sleepy, lost a little weight, got kind of tired. But I got better later.
And then you got better. Okay, you got better because you have a healthy immune system. When you got sick, those white blood cells, those T4 cells, came over and they fought that virus. They're like an army that goes over and fights that virus. That's what they did, and they knocked it out. They won, okay? If you have AIDS or the AIDS virus, what happens is that your blood cells, those white blood cells that fight disease, are destroyed, okay? So you get sick, what happens? You get sicker and sicker and sicker. You'd get that cold wouldn't go away, it would stay, it would get worse and worse and worse, because your body has nothing to fight those diseases. And that's why the AIDS virus is such a vicious virus, because it kills those white blood cells that are the most important part of your body's fight against disease. So therefore, your body is defenseless, and any germ that comes in can take over your body, and it won't get better, okay? Yeah.
Do you get sick and die from the AIDS virus or something else?
That's a real good question. And the answer to that is you get sick from something else. What the AIDS virus does is it kills the white blood cells that fight disease. And that means it opens up your body to any other disease germ that comes in, and there is absolutely nothing in your bloodstream or in your blood that can go over there and fight that disease. And what kills you is not the AIDS virus. What kills you are the other diseases you get, and we'll talk about them in a minute. Okay, now, Betsy said she feels fine, and so she can't possibly have AIDS, right? And the answer to that is wrong, and that is the most important thing that we have to get across to people about AIDS. You can have the virus, but not the disease. AIDS is what you call a slow virus, and that means it takes 8 to 10 years before any symptoms appear. So you can have the virus, you can look well, you can feel well, you can look healthy, you can feel healthy, you feel great. People looking at you would say, doesn't she look great? Okay, but you have that virus, and that virus is in there destroying your white blood cells. And therefore, you can transmit the virus, you can pass it on to other people during that time. You don't know you have it. And another reason the AIDS virus is such a vicious virus is because it sits in your blood, destroying those white cells for up to 8 to 10 years before you have any symptoms. But during that whole time, you can infect other people. So even if you look well and you feel well and you look great and you haven't been losing weight, you can still have the virus. Now, what happens is then, once the virus gets into your blood, for 8 to 10 years, it sits there. It does its nasty work. Okay. Then maybe 8 years from that time period, 8 years from the time you get infected, 9 years, you begin to develop symptoms, what we call AIDS-related complex. You get fevers, you get night sweats, you're tired all the time, you get swollen glands, and your glands are under your neck, right under your arms, and in your groin, okay? And you develop all those symptoms, and that's AIDS-related complex. And then maybe 2 years from that, you develop full-blown AIDS. Now, full-blown AIDS means that there are a lot of opportunistic infections that take over your body. And we call them opportunistic because they're very rare infections. And when they see an opportunity to take over your body, they'll do it. And the problem with AIDS is that because it's destroyed your immune system, those white blood cells, those infections that we never see in healthy people, people with healthy immune systems, take over your body, and that's what kills you. There are things like thrush in your mouth, and that's a white yeasty infection in your mouth. Pneumocystis carinii, pneumonia, a very rare form and very dangerous form of pneumonia. Things like Kaposi sarcoma, which is a rare skin cancer. Certain kinds of brain diseases that take over. Severe diarrhea that you can't stop. All sorts of parasites and bacterial infections. And also, we're just learning the original studies on AIDS were done on gay men. And so a lot of symptoms that women get were not included in the AIDS diagnosis. But now we're seeing that there are a lot of symptoms that women get that are also signs of AIDS. Things like thrush, or that white yeasty infection in the vagina that just won't go away. Pelvic inflammatory disease. Some people think cervical cancer may be related to AIDS. So tuberculosis seems to be related to AIDS. So what kills you are these other diseases that take over your body when your immune system is destroyed by the virus. So that's what happens then with AIDS. It invades your blood cells, okay? It sits there for 8 to 10 years until you develop AIDS-related complex. Then you develop these symptoms, and then maybe 2 years from there, you develop all of these diseases. okay, that we've talked about. And that is what kills you. Those diseases kill you. The virus doesn't.
If somebody is living in my house, can I get AIDS from them by just living around them?
Can I get AIDS from someone who coughs or sneezes on me?
What about kissing? Does that give you AIDS?
What about mosquitoes? Water fountains?
You can't get AIDS through what we call casual transmission. You can't get AIDS through doorknobs. You can't get AIDS by kissing or hugging someone who has the AIDS virus, HIV, or who has AIDS. You can't get AIDS through public restrooms or toilets. You can't get AIDS if someone with AIDS or who has the AIDS virus, HIV. You can't get AIDS if they sneeze on you. You can't get AIDS in these ways because the virus only lives in 3 bodily fluids. The virus only lives in large enough quantities to be transmitted in 3 bodily fluids. It lives in blood, in semen, or cum, or the woman's vaginal fluids, or the wet inside of her vagina. So if you think about it, this is why AIDS, or the HIV virus, cannot be transmitted in these ways. It can't be transmitted through casual contact, unless there's, obviously a lot of blood present. So you can't get it through public restrooms, toilets, doorknobs, kissing someone on the cheek someone who has the AIDS virus. You can't get it these ways. There are 3 ways that the virus is transmitted. From a pregnant mother who has the AIDS virus can give it to her unborn child. It can be transmitted through sharing IV drugs or the works that are involved, the needles, the cookers, the rinse water, and the cotton. And it could be transmitted through sex. Now, if you think about the first way, mother to child, pregnant mother to her unborn child, the pregnant mother and her unborn child share just about everything: blood, food, and the virus can also be transmitted in this way from the mother to the child. And there's about a 1 in 3 chance that if the mother has the AIDS virus, has HIV, that the baby will eventually the baby after it's born will eventually go on to develop AIDS. There's about a 30% chance of that happening. Now, if you think about the second way, through IV works or drugs, anytime, because the virus lives in blood, anytime people share either needles or drug equipment, there's always a little blood, either in the barrel of the syringe or in the needle itself. And there's there's also blood in the rinse water too. Obviously, there's also blood in cotton, and there's also often blood in the cooker. So anytime people share any of this equipment, it's like taking the blood from one person and putting it directly into another person. So this is how the virus can be transmitted, through sharing IV work. Now the third way, sex. By this I mean sex without condoms in particular. Now there are 3 ways that the virus can be transmitted through sex. The virus can be transmitted through oral, anal, or vaginal sex. By vaginal sex, I mean penis in the vagina sex. The kind of sex that, penis in the vagina sex. What a lot of people refer to as normal or heterosexual sex, regular sex between men and women, the kind of sex that makes babies. And that's what I mean when I refer to vaginal sex. Now, if you think about it, anytime 2 surfaces rub together, that causes friction. And this friction can often produce little cuts or microscopic tears, so small you can't even see it, either on the man's penis or in the woman's vagina. And because the AIDS virus, HIV, only lives in large enough quantities to be transmitted in semen or cum or vaginal fluids or the wet inside of the woman's vagina and blood, if there are these little cuts present, the virus can be transmitted, can be passed on from one person. And it could go either way, from man to woman or woman to man during vaginal sex, if there are little cuts on the man's penis or in the woman's vagina.
What if he pulls out and doesn't come inside of you? Can you get HIV that way?
There's still little cuts, either in the woman's vagina or on the man's penis. And even if he doesn't come, if the woman, for example, has HIV, has the virus that causes AIDS, and it's present in her vaginal fluids, even if the man doesn't come, the virus can still be passed on to him through those little cuts. There's also pre-cum, or there's wet stuff on the man's that comes out of the man's penis even before he ejaculates, and HIV has been found in this pre-cum as well. Now it could be passed on through anal sex in essentially the same way. Only the butt, and by anal sex I mean penis in the butt sex, or sex from behind in the butt. Now if you think about it, it could be passed on in a very similar way. Only the butt muscles are tighter, and the skin or the tissue inside of the butt is even more sensitive and can break more easily than the tissue inside of a woman's vagina. So if you think about anal sex, the virus, this is another good way for the virus to be passed on, because the muscles inside of the butt are even tighter, and the skin is more delicate and can break more easily. So there could be, even more blood, more breaks on the penis or in the woman's vagina, and it could be passed on, again, either way, from man to man, between men, or from woman to man or man to woman.
So if I don't penetrate during sex, I decrease the chances of getting AIDS. What about oral sex?
The last way that HIV or the AIDS virus can be passed on through sex is through oral sex. Now, a lot of people think you can't get HIV or AIDS through oral sex. That's wrong. You can. The same way people who have oral sex can get any other kind of sexually transmitted disease, they could get AIDS or HIV, the virus that causes AIDS, in much the same way. If you think about it, in the wintertime especially, your lips are dry, they're cracked, you do what I do, you bite the inside of your mouth a lot, or sometimes when you brush your teeth in the morning, there's sometimes a little blood on the toothbrush, or your gums are a little sore. We often have a lot of little cuts in our mouths that we don't even realize. And these are cuts. This can be passed on from the cut, through the cuts in the mouth to the man's penis or the woman's vagina. And it could also go the other way. It could be passed on from the woman's vagina or the man's penis, especially if there are vaginal fluids or cum or semen present. It could be passed on to the person who's giving oral sex, through these cuts in their mouths. People often have sore throats, and that might be another point of infection or root of infection. So it could be passed on through oral sex as well. And it's important to know that it could be passed on through oral sex on a man or a woman, because there are little cuts present in our mouths, and it could go either way in this case.
You guys were talking about needles before, and what about the needles that you use in blood transfusions? And also, what about the needles that you use, like when you pierce ears or you get a tattoo? Can you get AIDS from those?
That's a very good question, Betsy. The virus doesn't care what kind of needle it's in. The most common way of needle transmission is through drug needles, but through ear piercing, tattooing, anytime a needle is used and has blood in it, you can get AIDS. Vitamin shots, ear piercing, tattooing. That's not the piercing guns, because the ear piercing guns put the earring through your ear, and it's only the earring that touches your ear. But if you, as my ears were pierced with a needle, and if you use just a needle, and somebody else has used it before, then in fact it can transmit the virus. So that kind of transmission does occur. And as far as blood transfusions, before 1985, it was likely that you could get AIDS from a blood transfusion because the blood wasn't tested. Now, when you come in to give blood, they ask you questions about your behavior, whether you've engaged in any of the kinds of behavior that Lewis talked about. And then if they then will test your blood. And if the blood has any AIDS virus in it, they'll discard it. So the chances of getting AIDS from a blood transfusion now, although it's possible, are very, very, very small because the blood is tested.
You get either a blood transfusion, or when you donate blood, when you give blood, they only use the needle once and then they throw it away. So you don't have to worry about needles in that case.
Well, there are things that we can do to protect ourselves from AIDS. And the first one of those involves drugs or any kind of needle sharing. Now, the best thing to do if you're using drugs, if you're shooting drugs, is to stop, because then you can't get AIDS in that way. But if you know somebody who can't stop shooting drugs, then tell them not to share needles, because as Louis said earlier, sharing needles is the quickest way to get AIDS, because you're injecting that virus right into your bloodstream. Now, if you can't, now there's also another way to prevent AIDS, and that is to clean your needles. To clean a drug needle, what you do is you draw Clorox or bleach into the needle and then shoot it out. You draw it into the syringe and shoot it out 2 times. And then you rinse the syringe. You draw water in and shoot it out 2 times. And if you do that, the needle will be clean. But the problem with that is that if somebody wants to shoot up, they're not going to stop and think, well, I have to clean a needle, I have to go get some bleach. If they're going to shoot up, they're going to shoot up right away. So if, in fact, people clean needles, then that's one way to prevent getting AIDS. But the safest way is to either not share needles or to stop using drugs altogether, because then there's no way you can get AIDS through that means. And the other thing is, of course, if you use needles for tattooing, for ear piercing, for vitamin shots, or any other kind of thing, don't share those needles. It's very, very dangerous.
Okay, there are a couple of other ways to prevent from getting the AIDS virus, and those have to do with sex. Now, one way to prevent from coming into contact or being exposed to the AIDS virus is obviously not to have sex. That is, to practice abstinence. Because obviously, if you're not having sex, then you're not going to come into contact with either someone's blood, semen, or cum, or vaginal fluids, or the wet inside of a woman's vagina. So even if there's HIV in any of these, you're not going to come into contact with them, so you're obviously not going to be putting yourself at risk. And that's just, you know, and that's, again, just to practice abstinence. For people who are having sex, though, the best method we have of protecting ourselves is to use this. These are condoms, chumpies, rubbers, raincoats, jackets, hoods, whatever you want to call them. They're all, you know, they essentially work the same way. I should mention that there are 2 kinds of condoms. There are lambskin condoms, or natural condoms, as they're sometimes called, and latex condoms. And latex is a kind of rubber, which is why they call them rubbers. Stay away from lambskin or skin condoms or natural condoms. They don't protect you against the AIDS virus. The virus is so small that it could actually pass through these skin condoms. Stay away from them. They don't work. They don't prevent, you know, they don't prevent the spread of AIDS or HIV, the virus that causes AIDS. Just stay away from them. They're more expensive, they're harder to find, and they don't work. So there are a number of reasons you should just stay away from skin condoms. And, you know, if anyone you know has any misconceptions or misinformation about skin condoms, you know, make it clear to them that skin condoms don't protect you against AIDS or HIV, the virus that causes AIDS. Use the other kinds of condoms. Use latex condoms. Now, with latex condoms, there are 2 kinds of latex condoms. There are lubricated and unlubricated latex condoms. Now, you want to use the lubricated condom for anal or vaginal sex. This improves, this makes it lubricated and makes it slide better. And when you buy when you use lubricated latex condoms, make sure that they have a spermicide in them called nonoxynol 9. And what this does, what the spermicide does, what nonoxynol 9 does, is it kills both sperm and the AIDS virus, HIV, the virus that causes AIDS. So you're doubly protected if you use lubricated latex condoms with nonoxynol 9, because it'll kill sperm and HIV. So you're doubly protected in case the condom slips or breaks or something like that. Just remember, for anal or vaginal sex, use lubricated condoms with nonoxynol 9 to kill sperm and HIV. Latex condoms can now be bought with nonoxynol 9. You have to look for it on the package, but it should say it if it has nonoxynol 9 or not on it. Never use what we call oil-based lubricants. Never use things like Vaseline, Crisco, cooking oil, baby oil, or hair grease on a condom, because this can cause the latex to break. Anyone who's ever painted may know that you're not supposed to mix oil and latex paste. And this is for the same reason. You're not supposed to mix oil and latex. So never use Vaseline, cooking oil, baby oil, hair grease on a condom, because then it can really break. So the lubrication often comes on the condom, or now you could buy commercial lubricants like KY or Foreplay, which are water-based lubricants, which you can put on the condom or inside the condom, or both, for this extra protection. Okay. There are a few things you should know about the proper way to use condoms. The first thing to look for when you buy a condom is if you're going to have anal, penis in the butt sex, or vaginal sex, or penis in the vagina sex, is to use a lubricated condom with nonoxynol 9, because it'll kill sperm and HIV. The next thing you want to look for when you look to buy condoms is to look for the expiration date, and to make sure that the date that the condom expires is at least several months in advance. You certainly don't want to buy a condom that is already expired, for obvious reasons. Now, in terms of handling condoms, don't keep them in your wallet. Don't put them in glove compartments. Keep them out of the sun. Don't keep them in your pocket for long periods of time, because the heat can both dry out the condom and also make it weaker, and this can cause it to break when it's being used. Store it in a cool, dry space. Okay. Now, when you open a condom, don't open it with scissors, because you obviously don't want to cut the condom or, make little holes in it, obviously. Just rip it open, and it should be fine. Now, the proper way to use a condom is, most condoms, or a lot of condoms now, have little tips on the end. And before you put on a condom, what you want to do is pinch the tip, and then put it on an erect penis, obviously erect, and just roll it down all the way to the base of the penis, so that it's right up against the man's body. And then once it's on, you just go to work, and you should be safe. You should be pretty safe using this, especially if you use it the right way. Remember to just pinch it before you roll it down, and that's to leave room for what comes later. And then you just roll it down all the way, and then go to work. Now after you use a condom, the way to take it off is to, after the man has ejaculated or come, what you do is you push it down, you push it off from the bottom here, from this little ring. You just push your fingers right behind it and just push it off. It should just slide off, because it's slippery inside now, if you think about it, and it should just slide off, and you could just push it off into a garbage can, or a wastebasket or something like that, or on the floor. Another way to take off a condom is to just use some tissue and just pull it off. Put some tissue in your hand, and then just pull it off with tissue. What you want to avoid is putting. If you have any cuts on your hand, what you want to avoid is putting your hand on the condom in case there's HIV on the outside of the condom. So among the safest ways to do that are to just push it off from behind into a garbage can or onto the floor, or to take it off with a tissue. So this way your hand doesn't come into contact with it. One other thing I should mention is, after a guy ejaculates or comes, you want to hold the condom from the base when you pull out. And this is so it doesn't slide off into either someone's butt or a woman's vagina. Because if it falls off into there, then obviously there's no point in using it. You also don't want to, you want to help prevent it from spilling out, to help prevent the semen from spilling out. So when you pull out, right after you come, you want to hold on to the condom from the bottom and just pull it out. And this is to prevent it from slipping off, or to prevent anything from spilling. And then you push it off, or you take some tissue and you throw it away. Never reuse a condom. Once you use it, just throw it away. You can't wash it. Don't dry it. Once you use it, just throw it away. And if you have to use another one, get it. Or if you need a condom again, use a different condom. Remember, just use it once and throw it away. For oral sex on a guy, you obviously don't want to use a lubricated condom. It won't kill you if you get the spermicide or the lubricant in your mouth, but it doesn't taste too good, and you obviously just don't want to use it. You want to use the other kind of latex condoms, which are dry condoms, and these are just that, dry condoms that don't have any kind of lubrication on them. And you use those in the same way that you would a lubricated condom. You open the package with your hands without scissors, or a knife or anything like that, and you roll it onto, you pinch the tip, and then you roll it onto an erect penis just like you would a lubricated condom, but only this is a dry condom. So you roll it down, and then you go to work, for oral sex on a guy. And if you think about it, this provides a barrier between the man's penis and the person's mouth, so that if there are little cuts on the mouth, they won't come into contact with the semen or the pre-cum, and vice versa. The man's penis won't come into contact with the person's mouth. So this way, it's a barrier, and both people are protected. And these condoms are pretty thin, and they work. So the sensation should be pretty good, just as good. Now, for oral sex on a woman, they have things now that are called dental dams. And what these are latex barriers. Latex is, they're made out of the same material that regular condoms or rubbers are made out of. These are latex barriers. These are squares of latex which you hold over the woman's vagina before you perform oral sex on a woman. But they're sort of expensive. They're still hard to find. But there's a cheap and easy way to make a dental dam out of a regular dry latex condom. And what you do is you get a dry latex condom and a pair of scissors, and you make two cuts. First, you cut off the tip, and then you have what looks like a donut. So guys, you're obviously not going to use this on yourself because there's no point in using it. It has a big hole in the middle now. So you make two cuts. You cut off the tip, and then you stick the scissors through the middle. And then you make another cut, right? Two cuts. And then you unroll it. And you have a dental dam. And this is a square of latex. Remember, you used a dry condom, and this is a square of latex. And you can see it's pretty thin, and you hold it over the woman's vagina before you perform oral sex on a woman. Using condoms and dental dams are good not just to prevent AIDS or HIV, but are good, to help prevent other STDs, sexually transmitted diseases as well. Now, some guys say, I'm too big for a condom. Honey, baby, they haven't built one that could fit me yet. So I can't wear one of those because it's just not going to fit. Well, let me show you something. This is a condom. It stretches pretty far, for one. And as you can see, they get to be pretty big, and they can stretch when they need to. So, if one size really does fit all, and guys, if you think or if you are bigger than this, then you shouldn't be having sex. You belong in the circus.
There's one more thing you can do to protect yourself from AIDS, and that is to be tested. Now, we talked earlier about being tested, and there is a test now that will tell you if you have the AIDS virus in your blood. Now, remember, we've said a lot of times that there's a difference between having the virus and having the disease. And you can have the virus for 8, 9, 10 years before the symptoms of the disease start. Now, it's very important to know whether or not you have the AIDS virus. Now, what the test is it's very simple. It's a blood test. And what they do is they'll talk to you about what the test means. Then they take a little blood out of your arm. And then you go back a week or so later, and they'll explain to you what the results are and what they mean, whether you have the AIDS virus or not. Now, it's very simple to get the test. The test is free. And they'll ask you your name when you go, but you don't even have to give your real name. If you don't want anyone to know who you are, you don't have to give your real name. Now, what they'll do, and that will tell you whether your blood has the AIDS virus or not. Now, who should get tested? Well, we should get tested for a number of reasons. In the first place, if you've engaged in any of the kinds of risky behavior Lewis has talked about, if you have shot drugs, if you have had sex with someone who shot drugs, even if they shot drugs 5 or 10 years ago and have stopped, they could still have the AIDS virus even if they look healthy. You should also be tested if you've had sex without a condom with someone whose sexual history you don't know. And you know, a lot of times guys say, well, baby, there's only you, but can we really believe them? Well, sometimes we can and sometimes we can't. If you're not sure, you can get tested. Now, another reason to have the test is if you're thinking of having a baby. As we said earlier, if you have the AIDS virus, there's a 1 in 3 chance it can be passed on to a baby. And so, therefore, you and your partner may want to get tested before you're thinking of having a baby. And there's another reason to get tested, and that is just so you're sure. There are a lot of folks that think, well, I don't think I've ever engaged in risk behavior, but I ought to get tested, just to be sure. And so a lot of folks get tested just to be sure. Now, if you and your partner both test negative for the virus, that means your blood doesn't have the virus, and you have sex only with each other, you cannot get the virus. So that is a real good reason to change your behavior, to have only, or to have only one partner. If you and your partner are both negative, then you can't give the virus to each other. That is, if your blood doesn't have the AIDS virus, you cannot give the AIDS virus to each other if you have a relationship only with each other. So those are all reasons to get tested. Now, if you test negative, and that means your blood doesn't have the virus, how do you feel? You've been tested, Lewis. How did you feel after you were tested?
I've been tested 3 times, mostly just to feel sure, and just to know. And I have to say, I felt good after I got my results back.
Now, if you do test positive for the virus, that is that your the test does pick up antibodies to the virus, then there are things you can do for yourself. You can take better care of yourself. You can be very, very careful when you have sex with other people, because it's important to know that you can reinfect yourself. If you do have the virus and you have sex with someone who has the virus and get another dose of the virus, it means that your body will progress to AIDS faster. You can reinfect yourself. So you can take real good care of yourself and good care of other people. And there's also a medicine now called AZT that doesn't stop AIDS or cure it, but it slows it down. It keeps the virus from multiplying in your body. And so what have we said today? We've said that AIDS, the acquired immune deficiency system, is a virus, that it gets into your blood, it destroys your immune system, or the white blood cells that protect your body against disease, that you can have the virus without the disease, you can look and feel well and healthy and not even know you have the virus, that it takes 8 to 10 years for symptoms to develop and another 2 years or so before you get full-blown AIDS. We said you can get AIDS from, it can be AIDS as in the vaginal fluids, the man's semen or cum, and in the blood. You can't get it by casual transmission. You can get it only from mother to child when the woman is pregnant. You can get it through oral, anal, or vaginal sex. And you can get it by sharing needles, or either shooting drugs or for some other reason. Now, you can protect yourself against AIDS. You can protect yourself against AIDS by not sharing needles or by stopping shooting drugs altogether if you know somebody who is. Or you can get it by using latex condoms. And latex condoms, or you can make a dental dam, or you can prevent it by using latex condoms. And latex condoms or dental dams are the best preventive against spreading AIDS through sex. We can't cure AIDS at this point. There is no cure and there is no vaccine. There's only one protection against AIDS, and that's knowledge.